In the northwest, consultants at Sligo University Hospital say the hospital's orthopaedic operating theatre is no longer fit for purpose and patient safety is being compromised. Water leakages from the theatre's roof in recent years have disrupted surgery at the hospital. Our northwest correspondent Shane O'Careen met with 3 orthopaedic consultants at the hospital last night.
My name is Barry O'Neill. I am a consultant trauma and orthopaedic surgeon here in Sligo University Hospital. We as a group are responsible for the healthcare of a large number of people here in the northwest of Ireland, and at the moment our ability to provide safe care for these people is being compromised.
The heavy rainfall recently resulted in a leakage in the roof of the orthopaedic operating theatre at Sligo University Hospital and forced its closure for 8 days. Similar situations have arisen in recent years.
We are just really frustrated here in Sligo.
Orthopaedic consultant John Kelly.
Every year we're stopped from doing any elective operating for 4 to 5 months because of bed pressures and trolley crisis. So it's hard enough to get patients into the hospital. But then when we get them in, we have to deal with leaky roofs. And anytime we have a heavy rainfall, we have a leak in the roof. And there has been about 5 leaks in the last 2 years. But if we have a leaking roof, clearly that represents a significant infectious risk to the patients. An orthopaedic infection of a joint replacement has a worse survival than a new diagnosis of breast or colon cancer. It is mostly preventable, and that is our concern.
Orthopaedic consultant Robert Hurley started at the hospital this year.
I'm operating in an orthopaedic theatre that was built in 1980 based on plans predating that. And I've never worked in a theatre as poorly resourced and as old. And I've worked around the world at this stage and I've never been in that environment. And at this juncture, it, I feel, is unsafe to proceed. We can deliver world-class care here from experience and training that we've gotten abroad, and we're being hindered from doing that.
The consultants feel hospital management are trying their best.
Now, we've spoken to the local management numerous times and they're very much aware of the situation and of our concerns, and they share those concerns with us.
Management are doing their best, but they're not being resourced properly or funded properly by the Minister for Health or the officials in the Department of Health.
John Kelly says the consultants feel a new multi-service surgical block is needed in Sligo.
We need a new multi-service block to guarantee and future-proof surgical services in the northwest. It is impossible to attract, or will be impossible to attract, highly trained specialists to come and work in Sligo if we can't give them the basic environment to do that work.
Minister for Health Jennifer Carroll McNeill says she is well aware of the issues at hand.
Well, I'm well aware of the difficulties that the orthopaedic team have had to go through this year in Sligo, and that there has been a leak, particularly exacerbated during last week's really heavy rain. But they shouldn't need to deal with that. And I know that there's a plan that the HSE have to fix that, to do remedial works to fix that. I've spoken to the regional director in relation to that, and I expect to see him progress that, because that simply has to happen. More broadly, surgical capacity has to be increased generally in the northwest.
The HSE say they are working to address the issues. A business plan supporting the implementation of a surgical hub was submitted to HSE Central this month. Dermot Mullen from the HSE.
Currently submitting a business case to the HSE Central to identify where we believe the centre should be. That will be considered by the HSE Central in a decision recommended to government.
John Kelly with the final word.
We are here to work. We want to operate. We need the ecosystem available to us to provide that care. We're working in infrastructure that is no longer fit for purpose. It is falling down around us, and the people of Sligo and the greater region deserve better than what they're getting at present.
That's orthopaedic consultant John Kelly ending that report from Shane O'Careen.